Hello and good evening to all. Before I welcome our guest in the show today, it's a quick intro on what we're discussing. On Wednesday, the Supreme Court of India, through an interim order, directed the government to ensure that all approved labs in India, including private labs, offer free COVID-19 testing. In line with the order, a healthcare startup Meddo, most of you know the name, has started providing free of cost testing. To talk more about how Meddo is doing this, how customers can avail this service or benefit, and other details around this topic, we have the company's CEO with us, Saurabh Kochhar. Saurabh, thank you for joining.
I'm out.
To begin with, just tell me how Meddo is serving as an enabler in conducting tests. Do you own some labs? You have partners? How does it go?
So for this particular thing, we have actually partnered with a number of ICMR approved COVID testing labs, which kind of help us get through to our patient base and even broadly, right? And be able to kind of serve, this entire pandemic. In fact, that's not the only thing we're doing. Honestly, testing is very key and important, but not the only part of the entire gamut, right? I think it all starts by knowing the right symptoms, knowing when to seek help, getting to a doctor, and each one of these steps today is a problem, right? So what we have tried to enable is not only the testing bit, but also the path to the testing, right? So we have our own telemedicine platform, which we have actually rolled out to all doctors for free now. So any doctor across the country can use our telemedicine platform for free, enable their patients, any external patients, at least for the time being that we go through with this entire pandemic, right? So we've kind of opened it up for everyone. So starting from symptom checker, we have our testing bots. We have doctors who are available on online for teleconsultations. We have about 300 odd clinics. Many of them are open even through all of this. So we are dominantly NCR based, so which is why most of these services are in NCR. But yeah, so those clinics are open in case you do need a in-person follow-up, and then of course ending with testing and results and making sure that you're getting the right kind of care.
So as we speak, the free of cost testing that is available is limited to regions Delhi, NCR.
That's true.
And the regions shall be Delhi, Noida, Ghaziabad, Gurgaon, and Faridabad.
Right. So while that is the broad reason, getting into Noida is slightly tougher at this point, and pockets of Gurgaon also. So the pockets which have been quarantined are a bit tougher to reach. So while broadly what you're saying is correct, but there are certain pockets that we are not able to reach because of the the quarantine. So kind of we have to leave those out. But yeah, apart from that, broadly NCR.
Okay, so you've mentioned a few important steps on how one can get started. I would preferably like to discuss all in detail for our viewers.
Sure.
So if, say, I have to get tested for COVID, how do I start?
So like I said, before testing, so the two necessary conditions for getting tested are you having a valid prescription from a registered medical practitioner. And that there is also a format for that prescription, and it has to be, written in a certain manner, and the prescription should also look in a certain manner, right? So the medical registration number of the practitioner should be clearly mentioned. The council should be clearly mentioned. It has to be signed and stamped by the practitioner, and as per the guidelines, the government has also said that all COVID cases should be looked at in person rather than not only teleconsultation. So I think there's a process to it. So that process thereby needs to start a lot earlier. Like I said, you can log into Meddo, and there is a symptom checker. It's a bot called Mia. So you can log in and you can put in your symptoms and see whether you are at low, medium, or high risk of having contracted the infection. And then based on your risk levels, you should go for either a direct hospital or a clinic where you can get yourself checked, or for low or medium risk, you can even try starting with a teleconsultation, speak to a doctor, and then see whatever the doctor suggests.
So in case of teleconsultation, I think a lot of symptoms for COVID-19, which are not very crystal clear, but yes, some of them are common to things like a common flu or bronchitis even. So do you think teleconsulting helps there in sort of negating false approvals? Or would you rather recommend or encourage somebody who assesses himself as at risk to visit a nearby hospital or a professional clinic?
So at the current infection rates, India has about 5,000 odd or maybe 6,000 cases now, right?
Yeah.
So 6,000 odd cases that have been totally detected amongst the population of 1.3 billion. Amongst the tests that are being converted, the positive conversion rate is actually less than 10% in terms of tests being conducted versus people turning out positive. In such a huge disparity, I think it's important to take a balanced approach. So you don't want to fill everybody into the hospitals at this point, right? Because then the one person can actually give the infection to 15 other people who are just walking into the hospital. So at this point, I think it's very important to be cautious and to be balanced in our approach towards who all go to the hospital versus who all kind of stay at home and at least get themselves some kind of medical attention. That's where the telemedicine comes into picture, right? So, and giving you some numbers from our own bot, right? So of the people who kind of tested the bot, more than 90% were low to medium risk, which did not really need immediate in-person attention. Right. So given those kind of numbers, I would say it's actually better to start with a teleconsult. And when we say teleconsultation, it's not necessarily chat or audio. We are also enabling video, right? So if there is something, or is there a skin rash, or there is some other visible symptoms, then the doctors can check over the video calls as well. So it's not limited to just audio. So all the visual cues are there. Yes, the things that you miss out on are, I can't check your pulse, right? I can't kind of have that kind of a comfort feel, but it's still good enough, or in fact not good enough. It's actually doing great in terms of eliminating the obvious negatives.
Right. So as I understand, your empaneled doctor can issue a prescription for COVID-19 test?
Any doctor can issue a prescription for a COVID-19 test, right? It has to be a registered medical practitioner. Right. So there is no limit on which doctor can versus not. If you are a qualified allopathic doctor, you can.
Right. So one has to simply download the prescription, print it out, and maybe go to how do you then proceed with testing? What's the second step?
You if you check out the website flow, when you land to the testing page, you have to upload 2 documents. You have to upload your ID and you have to upload your doctor's prescription. So you don't need to necessarily print it out. If you're coming through the Meddo platform and your prescription is already either through a Meddo teleconsultation or through a Meddo clinic, then we already have it in records, and then we can already kind of do it for you without having or without necessitating any uploads from your side. But if you're coming from outside, then yes, you have to upload your prescription, your ID, and then you can check out. And once we have verified from the back that everything is in order, then there is a call that arranges for the entire sample pickup.
Right. So talking of sample pickup, how long is that process? So if today I upload my documents, I have been prescribed or advised to get a test done.
Sure.
In how many hours can I expect a professional to show up at my house?
So it's mostly being done the next day right now, right? So with sudden surge, it might shift to 2 days, but mostly it's being done the next day, because the samples can be picked up only by certain trained professionals.
That's right.
There is a process even to the sample pickup in terms of who is qualified to pick them up. On top of their qualification, there is another training module that they need to go through. There is certain security procedures, there is transportation procedures, and then there are storage procedures, right? So all of these need to be fully trained, and thereby there is only a set of people who can do that. So we have to kind of manage a bit of the capacity on that side. we work with our same ICMR approved partner labs to kind of make the entire process fully seamless for the patients, which is why it's mostly being done next day, in certain cases 2 days.
Right. So in say up to 2 days, some professional will visit your home. The person need not go out, step out. It'll be done entirely in your premises.
Correct.
And with all precautions as recommended by ICMR regards to collection and sampling and transportation of the medium.
True. So that's how it's happening right now. What we are parallelly enabling with some of our partners is drive-through testing. Where there are facilities where we can simply car, you have to be on the right seat, on the back seat on the right hand side, and then there will be sample which will be collected from the window. Right. So while we're working on those kind of solutions, because as the volumes increase, as the free tests roll out, and I'm sure we'll come to that entire process very shortly. But as the volumes increase, as the volumes of testing increases, it's going to be increasingly difficult to do it at home. Right. So both in terms of bandwidth constraint, also in terms of how many, because there is, after every patient, I have to get out and I have to change my PPE kit. All of those things add both time and cost overheads.
Correct.
Right. So to ensure that we are minimizing the cost and we are maximizing the amount of samples that each trained professional can take in a day, it's better to kind of create these testing facilities, whether drive-in or walk-in, and still make sure that we are doing it in a manner where we are still containing the infection and not kind of propagating.
So drive-through model has shown some success, particularly in South Korea. I think Dubai has also adopted that model now, and even some Nordic countries as we speak. So do you see with the kind of lockdown we have, the strict and prolonged maybe after April 14th, is that a feasibility in another 2 weeks or 3 weeks?
So there are actually multiple things for and against that model, right? So which is, of course, I've talked about how a drive-through kind of a model can eliminate a lot of inefficiencies into the system and kind of bring people to the medical facilities. But then quarantine, etc., become a problem. Affordability become a problem. How many people in India do have cars, versus not? So those are still questions, but I think each one of these initiatives would take us certain steps further. What we can enable is that, tomorrow if we go through the drive-through testing, etc., then we can partner with the cab companies and kind of make sure that, those facilities are far more affordable and far more available to the common masses as well. So I think there are challenges, but I think with each challenge, there is equal opportunities for us and existing solutions, which we can repurpose to make things better, right? So I think India will need to find its own answer. It's a good, fantastic first step. A lot of countries, like you mentioned, have demonstrated it successfully. There are, our local realities on ground, which are different from those countries, but we also have solutions which kind of answer those challenges.
Right. So, okay. So if I get tested, my sample is collected. I believe this is a PCR test we're doing, right? RT-PCR.
Correct.
Okay. So as the standard time is, I think the report should come in up to 72 hours?
48 to 72 hours, yes.
Right. So if I get positive, and God forbid somebody gets positive, what is the follow-up plan? What does Meddo do in that case?
So I think the role on Meddo's side on that is slightly limited. The labs have clearly defined procedures in terms of what to do with positive cases, right? So there is you have to highlight it to the rapid response teams, the medical response teams that the government has created centrally and at state level, and then there is a proper quarantine procedure, and that's when the government and the disaster management SOPs kind of kick in. Right. So at that point, our role is slightly lesser. Our role is more towards increasing the top of the funnel and make sure enough people get tested, and if there is somebody who's positive, gets detected.
Right. So understandably, if somebody gets tested positive, eventually the government will step in, and then whatever the SOPs are, they'll be brought into place.
True.
Okay. So a quick question on how do you plan to expand? One, we are fairly under-tested, if you agree with how other countries are testing, rather aggressively testing.
Sure.
And two, Delhi NCR is one region. I think we have important hotspots in, say, Mumbai or even Kochi, for that matter. How do you plan on even expanding your teleconsulting services for this?
Right. So teleconsult we have now open across the country. So there is no limit in terms of where the patient can be, right? And like I said, by opening up our teleconsultation platform for free to all doctors, we have doctors from Bangalore, from Pune, from Mumbai, from Kolkata, who are all registered on the platform as we speak, right? And kind of serving their patients using the Meddo teleconsultation platform, right? So the good thing is, through the teleconsultation platform, we've already transcended the geographical boundaries in terms of providing medical attention. Unfortunately, testing is more specific. Testing is more physical in nature, and thereby we have to have geographic presence. So we are working with partners across other cities as well, who can at least for this entire time period, while we're still dealing with this entire COVID-19 coronavirus pandemic, for that period, we can at least roll out our services temporarily in other cities as well, and then kind of take a call more on geographic expansion.
Right. So, I mean, in the first place, teleconsulting does kind of help people lower their stress levels as well. I mean, those who are not very clear on, should I go out, should I seek a doctor help immediately or not, it somewhere does help alleviate those concerns.
Correct.
Right.
Even the bot, I would say, right? So even the bot. So the first thing is that, again, we have a limited amount of doctors as well, right? So both in the country, we have about, I think, give and take about 10 lakh doctors, right? So whichever numbers you believe, and those who are dealing specifically with these kind of cases would be less than 5 lakh, right? So with only that kind of doctors, I think it's also important to stage gate at every point, and thereby, for people who are actually low at risk, we can just eliminate them by saying that, just take care of yourself. There's nothing to worry. You don't need anything. Just sit tight. Yeah, this will pass. And then there is people who need medical attention, and there is people who need immediate help, right? So I think it's important to divide it across those categories.
Right. So while technology is a great enabler, I think the access to technology is also important here.
True.
Chatbots, teleconsulting is for those who have access to internet, to smartphones, etc. And there's a huge population of India that resides in pockets where we sadly do not have all these benefits. Is there a plan that Meddo has for those who are living in tier 3 or smaller towns, villages?
So we'll get there, right? So we also have something called a Meddo Foundation. In fact, again, we'll talk about it when we talk about the free test bit in terms of how we are rolling out. So through the Meddo Foundation, we do a lot of these activities, right? Where whether it's free testing, not only for corona, but we've historically done free testing for diabetes, for cholesterol, for heart conditions, for blood pressure, etc. In areas where the access is far more limited, right? So I think we have that arm which kind of deals with those kind of areas and population who lack clear access to internet and others. But that said, today with I think with the mobile revolution and the data charges coming down, I think it's more than 60% or maybe even 70% of the country which has clear access to internet and mobile. So we also have a tele helpline that we're working with, by the way, a couple of governments with as well, right? So we're working with them to kind of track and follow up with people who are already in quarantine or who have been identified as medium to high at risk, right? So we're doing follow-ups with them with a couple of governments where it's more phone and not internet or chatbots, right? So we're doing those kind of things in parallel. But if you talk about people who don't even have access to phone, I think that needs to be far more physical, and that's where somewhere we have not ventured yet.
Right. So as we speak, the government state governments across India are identifying potential hotspots. Some have already done that. They're cordoned off areas, they've sealed off pockets. If we get, say, a call from one of these areas, are you sending your lab assistants? Because the infectivity rate is higher than average in these pockets.
I am sitting in one. I'm actually locked down myself in one of those identified hotspots in Gurgaon, in Nirvana. So I know what you're talking about. I think there are medical teams who are now visiting door to door here in our area as well to kind of quickly check on tests. In fact, the good thing that the government and ICMR has done is that in these hotspots, they've also enabled the rapid card testing.
Yeah.
Right. So where the results are much faster, the costs are much lower, and honestly, method and time to administer is also much shorter. Right. So I think those things are already underway. If there is somewhere where we can step in and help, we are more than happy to. Like I said, we are already working with a couple of state governments to roll out services where they need help, right? So kit kits to har koi de pa raha hai, right? So the problem is that how do you track the guys who are high at risk and make sure that they are either quarantined and they're not turning symptomatic and things like that. So that's where we are also kind of bringing in our technology and our strength to kind of address those people.
Yeah, right. So about antibody tests, the rapid antibody tests, serological testing, that is, what is your take on that? Are you planning to get in touch with governments to enable that option as well for people who have access to internet and teleconsulting?
Sure. So we see what we can do is that we have the supply chain sorted, right? So if we have to now roll those out tomorrow, we potentially can. If we need to support the governments in doing that and creating the right kind of supplies, we can. Now, from there on, there is also, all of us know pieces of the puzzle, right? So there is broader guidelines being formed looking at all of these pieces of the puzzles together. So I think somewhere we also do need to respect that. So if the guidelines today do not suggest that we go out and roll out rapid card testing, I think we are more than happy to sit and wait it out and ensure that it's actually reaching the right hotspot areas first where the need is the most. Yeah. So to that effect, I would say if that happens, we'll more than welcome it, and we have all the things in place to kind of roll it out to the broader masses. But it's not something that I would say we are actively pushing for or something.
Right.
If you ask me my opinion, I think it's better to kind of roll it out sooner than later. But that's fine. It's just one more opinion.
Right. So talking of opinion, how do you view the Supreme Court order of allowing free testing in India? So if Karan Thapar would be interviewing you as a devil's advocate, he would ask probably, is it the right thing to do given our private labs are already pushed against the wall? 90% of the testing is already disrupted because of the lockdowns. Yeah. So there is a definite financial crunch here.
Correct.
With free testing, you're adding maybe insult to injury. How do you view that?
Right. No, I think the answer is a bit nuanced, right? There is two kinds of needs here. There is a medical need and there is a financial need, right? The medical need is that we need to roll out testing to more and more people, and we need to enable it through every channel possible. And private labs are a very, very wide channel, right? The kind of reach that we have, the kind of, whether it's in terms of labs or it's in terms of number of patients that we can reach.
But to cut you short, only 67 or 68 have been approved as of now, as compared to 120 the government approved labs.
All right. So for specific tests like RT-PCR, you need a certain setup, which generally is very similar to a swine flu testing setup. So what you would see is most of the labs that have been approved are the labs which already had swine flu testing capabilities certified, right? So as much as reach is important, control and quality of testing is equally important as well, because false negatives here hurt us far more than anything else, right? So I think that it's a right thing to kind of keep a control on quality as we roll this out too, right? So That said, there is also a financial need that you talked about, right? So if I don't know whether or not I'm getting money, how much money I am getting, or when I'm getting the money, it becomes very difficult for any businessman to kind of go out and do this in the full blast fashion. So now coming back to answering your question more specifically, I think medically it is the right thing to do. What needs to be done is to aid this with a very clear procedure around how the financial process works around it.
Yeah.
How are we going to track how many tests are being done? How are those tests going to be compensated? Is the compensation coming in terms of number of kits and number of PPE kits that each lab gets, and in turn the number of tests that they perform? See, with Aadhaar, etc., at least you have enough ID proofs and ID collections that you can do in terms of preventing duplicity, right? So with all of those things being broadly in place, I think all we need is a good financial process, starting from who we test, how we test, how do we get paid, how much we get paid, and when do we get paid. So I think that part of the process is still a bit of a black box. I know there are people who are actively working on cleaning that up. My sense is over the next couple of days, we should have some decent answers around the financial process as well. But the medical process is clearly needed.
Right. And the reason I raised that question is because, as you mentioned, Meddo Foundation is actually doing a lot here in offering or supporting these free tests. Could you speak a bit about that?
Yeah. So Meddo Foundation is our non-profit arm, where we pick these kind of projects and ensure that there is continuity, in the spectrum. If the Supreme Court has said it has to be free, but the labs don't know how to get paid, we kind of are trying to bridge the gap in between to ensure that for the passing time, if there is a tab to be picked, however subsidized, if there is a tab to be picked, we kind of bring it in through the Meddo Foundation and kind of make sure we tide over the next few days. And the bigger purpose of patients having access to the right kind of testing is served, right? So I think that's the broad role. Similarly, we are doing some one campaign around creating enough personal protection kits, PPE kits for the medical professionals, and there is one campaign that we're shortly going to take live in terms of supporting the healthcare workers, healthcare frontline workers who are I would say deeply impacted with this entire crisis.
Right. So I'll quickly take a couple of questions from Facebook. We have Saurabh Basu asking, what does the test consist of and what is the process? Could you just explain again what exactly are we doing with this free testing model and how someone can avail the benefit?
So this is basically the government approved RT-PCR COVID-19 test, where you take a nasal and a throat swab. So based on that, it goes to the lab, and within 48 to 72 hours, the lab kind of comes back with the results. The way you can book is in NCR. If you are in NCR, then you can log on to meddo.in and just follow the process to book your test. What you need to be able to book the test is a valid prescription from a registered medical practitioner and your government issued photo ID. Right.
So I think there's another question from Rashika.
Yeah.
Let's take that up. So all the relevant links for Meddo will be provided in our comment section.
Okay.
And it's a fairly easy to understand link, I think, where people can get started by themselves. There's also a number, I think you've mentioned, that shall also be provided in case somebody is unable to figure that out.
Sure. Yeah. So the link is meddo.in, meddo.in. Right. So all the other details, including the phone number, etc., you can get on the website.
Right. I think that's all we have for now. And Saurabh, thank you for your time. I think you're doing a great job with this initiative. And I hope lesser people turn up and India comes out of this battle at the earliest.
We're all keeping our fingers crossed, my friend.
Absolutely.
Thank you so much.
Absolutely. Thank you so much for your time. Thank you for speaking with Newsbites.